Hi there, this is Dr. Belitz, and welcome to another episode of the Ask Dr. Jack Show. Today, our topic is UTIs. Sorry, blanked out there for a second. Especially applying to women in this case. Women that have the symptoms of urinating frequently, having pain, things like that, will go to a doctor and they will get a test for to see if they have a infection of some sort. And in approximately 60 to 80% of the cases, they will find an infection, in which case they're given antibiotics and they go on with their life. But what about the 20 to 40% of the women that test negative? You know what? They're told they have this vague symptom called urethral syndrome. They're sent home with nothing, and guess what? They get overstuffed just the same as the women that are given a antibiotic. Sorry. So there's a university in Belgium that wanted to get to the bottom of this, and they did a test on 220 women that were complaining of UTI syndromes. And what they did was they used they tested these women, and they found that 98.2% of these women had an infection. What's the difference between the ones in that test versus the ones that only showed up in 60 to 80% of the people? It was the test. The test they used in Belgium was much more sensitive. So, think about how this goes on. These women that were sent home with this vague, weird infection or weird syndrome thing got over that infection. Probably they had a bacterial infection, just like the women that were put on antibiotics did. So, this is, again, not giving you medical advice. However, I need to give you something to think about. That's what my job is. So, if you are one of these people and you come down with a UTI, or at least the symptoms of a UTI, what should be the first thing that you do? Well, my suggestion is you stop into your chiropractor's office. You get a test to see how good your nervous system is working. If your nervous system is not up to peak potential, that might mean that your immune system is not at full peak potential, which might mean that's the reason that you have a bacterial infection. Get your immune system up, your bacterial infection goes away on its own without you using some kind of antibiotic, and maybe the symptoms go away on their own. Again, not trying to diagnose or treat a medical condition, but let's look at it from the chiropractic or natural healthcare standard. Find out, make sure that your immune system is working at 100% before you decide that there's something going on that you need an antibiotic for. Okay, that's it for this episode of the Ask Dr. Jack Show. I am Dr. Jack Belitz. If you have a question you'd like us to research, Ask Dr. Jack B, that's BEE, @gmail.com is a great way to get a hold of us. So is our phone number, 402-333-4848. You can use the same phone number to make an appointment to see how your immune system is working and maybe get that up to par in case you have a UTI, or how about any other type of cold, flu, anything like that. Your body is amazing at getting rid of this stuff without putting some type of drug into your body just to help it along. It might not need it. And let's face it, every drug that you have is going to have some type of side effect. Let's try to eliminate as many of those as we can. I hope you have a very beautiful, happy, and healthy day, and I can't wait to see you on the next episode of this Ask Dr. Jack Show.